Good afternoon. My name is Jacques Bahati. I'm a policy analyst with the Africa Faith and Justice Network. AFJN is a Catholic organization which advocates for fair policy between the US and Africa. I am joined by my colleagues, Isaac and Pauline. Please, Isaac, go ahead and introduce yourself.
Hi, my name is Isaac Evans-France, and I'm the director of Action Corps, which is a grassroots humanitarian advocacy organization. Thanks for watching.
Thank you. Pauline?
Hi, my name is Pauline Muchina, and I work for American Friends Service Committee on peace building, especially in Africa, and I'm their Africa representative here in Washington, D.C.
Thank you, Pauline. Today we are going to speak about COVID-19 response, international response. Indeed, COVID has shown that we are connected as a human family. But how do we respond when this human family is affected? So today, let's talk about the international response to the COVID pandemic. The International Monetary Fund, which is an international body, has strongly, since the beginning of this pandemic, suggested that they could indeed provide funding for affected countries to respond. Now, Isaac, you have been advocating for special drawing rights to be issued by the International Monetary Fund. First, tell us what the special drawing rights are.
Sure. Special drawing rights, or SDRs, are an emergency financial resource from the International Monetary Fund that won't cost US taxpayers a penny, but that can help countries prevent a deepening worldwide recession, and therefore help countries protect the people of their countries against starvation, disease, and death.
Thank you. Pauline, there have been a resistance to get the IMF issue these funds. What is the problem?
We're trying to determine what the issue is because, as Isaac said, there won't be any cost to the US, but politically, there have been some resistance on Capitol Hill, Trump's administration, and also the Treasury Department. So we have been telling them that it's humane to release these funds to save lives around the world, and that the political resistance we are experiencing is not acceptable.
Isaac, in your meetings with members of the administration in the Congress, what are they telling you about this response?
What I'm hearing is that members of Congress are interested in this. They're looking to cut through the political rhetoric. They want to move forward with solutions that will benefit people around the world. And this will also benefit people in the United States, because United States exports have dropped drastically this year due to the pandemic. Many developing countries cannot afford to import US goods. And with these international resources that are not from the United States, but and won't cost US taxpayers, with those resources, countries will be better able to import the goods that they need, whether that's food, medicine, or other necessary supplies. And that will actually help boost the US economy and help with US economic recovery.
There have been a chatter about countries such as Iran, which is under economic sanctions, that they will indeed get access to these funds. Is that true or not true?
First of all, 99% of the resources would go to other countries. There are 189 members of the IMF, 189 countries, that would benefit from this issuance of these international resources. And Iran would benefit, if Iran got any SDRs at all, it would be negligible benefit. Iran is prohibited from trading SDRs due to the sanctions.
Pauline, should the US punish the whole world because of sanctions on their enemies?
Absolutely not, especially since the mechanism itself in place will prevent Iran and other countries under sanctions from cashing their SDRs. So that's not an issue. That's just a lame excuse if anybody is holding on to that.
So now the American people, they are the ones who work for this money that we contribute to the IMF so that the US and other countries can be member of the International Monetary Fund. But this money is not the money we are talking about. It's no US taxpayers' money. So what is the problem? That we will not, that the US cannot truly allow the IMF to go forward and join other countries that have been calling for these funds to be released. Is there even any precedent that we can lean on in terms of saying, okay, this has been done before? Isaac.
Yeah, this was done in 2009 in response to the global financial crisis at that time. The United States authorized the release of these international resources from the International Monetary Fund. And it's time to do that again. There's legislation, S4139, and S4139 in the Senate would release these emergency financial resources, would authorize the IMF to release these emergency financial resources that don't have to be paid back, they're not loans, and would help countries fight poverty, disease, and death in their countries. And this has been done before. It's had wide bipartisan support, and it's time to do it again, but at a much bigger scale in proportion to the size of the current crisis.
Pauline, some Americans will say, oh, we have also some needs here at home. Why do we want to send money to other countries when they hear that, oh, we need international solidarity and so on? Can you clarify that question for those who are concerned?
First and foremost, it will not be taking money away from Americans, because no taxpayer money or US government money will go into the SDR. So that needs to be understood. The second part is we are one family. We are a global village. What happened in China is happening here, is happening in Kenya, is happening in South America, it's happening around the world. A pandemic is for all of us to figure out how we respond to this. If we don't, it affects all of us as the human community. So the Americans have to understand that even though they may get vaccines here, they will not be completely safe if the pandemic continue ravaging other parts of the world. We need to heal the world so that we can all be safe. It's not like, things like malaria that can be contained in one place. No, this pandemic, we've seen how it has ravaged. Today it ravages New York. The next thing it's ravaging, southern states in this country and Western countries. So we have to respond to it as a problem for humanity. It's not a problem for one country.
Wonderful. Indeed, we need to heal the world because the world is very sick. Isaac, would the United States also gain some money from these efforts?
The United States would benefit primarily by support of US trade partners. So countries that have been suffering economically, that have been unable to import US goods would be able to recover faster and would have the capacity to continue to trade with the United States. So that would benefit the US economy. It's like what Pauline said, we are connected, the global economy. If the global economy completely tanks, that's not good for the United States. What's good for the world is good for the US.
Now that we need to heal the whole world, what message are you sending to members of Congress who have the power to pass this legislation so that the Treasury can then go to the IMF and say, yes, we, the United States, are for this policy? What are you telling the elected official who have the legislative power? Thank you.
We're asking our members of Congress, our senators and representatives, to support a global COVID response, and you can take action for that at globalcovidresponse.org/# #TakeAction, and you can send a quick note to your members of Congress, letting them know that you want global COVID response and that we need that action now. We're aiming to have this done by the end of this year.
Thanks. And also just to remember that they need to, have a heart to save the world. Saving lives should be a priority. Politics should come secondary. And they can do it without any expenses on their part or the United States. So from a moral perspective, we are urging them to do the right thing and authorize, because they have vetoing power at IMF. Without their vote, these SDRs would not be released. These resources would not be released. So we need the members of Congress to authorize and urge the administration to ask the Treasury Department to go to the IMF and say, yes, we need new special drawing rights. We need these resources to heal the world.
Isaac, we are talking about the US as if the US is the whole world. What about other countries, the Europeans? Where do they stand on this?
Heads of state of European, African, Latin American, and Asian countries have asked the International Monetary Fund for a new release of these special drawing rights, this emergency financial resource. But right now, the United States is the one country that's blocking this from moving forward. And in conversations with members of Congress, there's significant interest in seeing this move forward. And we just need to urge them, as Pauline said, to vote in favor of this, to support this, to move this through.
Pauline, anything else you'd like to add?
Also, just to say that the people around the world, especially from Africa, from Kenya, where I come from, really need these resources. Without these resources, they will not be able to recover quickly from the economic downturn caused by COVID. And also, if we don't get these resources, we won't be able to save the doctors, the healthcare workers, the people who are working on the front lines of this pandemic. We need those resources so that they can be protected as they continue to heal people and to take care of people who are sick in African countries and around the world. Thank you.
Wonderful. As we try to heal the world, there are a lot of things to do and to consider. First, I think our hearts goes to the families that have been victimized by this pandemic. Second, we need to let our elected officials here in Washington that it is not good to take the whole world hostage. Indeed, other leaders have agreed to this policy, and we do not understand why this solidarity can be denied to those who are really in need. To you, Isaac and Pauline, thank you for your continued advocacy, and let's continue to do this so that the world can be healed. We talk to you soon. Have a nice day.
Thank you very much, Bahati.